What causes gout? Understanding the root of this painful condition. Gout is a common form of arthritis caused by the buildup of uric acid crystals in the joints. When uric acid levels in the blood become too high, the excess can form sharp, needle-like crystals that settle in the joints, leading to sudden, severe pain, swelling, and inflammation. Although gout most often affects the big toe, it can also appear in the ankles, knees, fingers, and other joints. These painful episodes, known as gout flares, can occur without warning and may last for days or even weeks. Several factors can increase your risk of developing gout, including genetics. A family history of gout can make you more likely to develop the condition. Diet. Consuming foods high in purines such as red meat, shellfish, and alcohol can raise uric acid levels. Medical conditions. Obesity, hypertension, diabetes, and kidney disease can all contribute to higher uric acid buildup. Medications. Certain drugs, like diuretics or aspirin, may interfere with the body's ability to remove uric acid effectively. Understanding what causes gout is the first step toward managing and preventing future flare-ups. Alongside medical treatments prescribed by your healthcare provider, lifestyle changes, such as maintaining a healthy weight, staying hydrated, and reducing alcohol intake, can significantly lower your risk and improve your quality of life. Stay tuned as we explore triggers, treatments, and proven prevention strategies to help you take control of gout and live pain-free. What is the main cause of gout? The main cause of gout is an elevated level of uric acid in the bloodstream, a condition known as hyperuricemia. Uric acid is a natural waste product formed when the body breaks down substances called purines, which are found in certain foods and produced naturally by the body. Normally, uric acid dissolves in the blood and is excreted through urine. However, when the body either produces too much uric acid or fails to eliminate it efficiently, uric acid crystals can form and accumulate in the joints. These needle-like crystals trigger inflammation, swelling, and intense pain, commonly in the big toe, but also in the ankles, knees, wrists, and fingers. Gout attacks often occur in areas farther from the heart, where the temperature is slightly lower, making crystal formation more likely. While gout is an inflammatory condition, it differs from autoimmune diseases, in which the immune system attacks the body's own tissues. Research indicates that gout also has a genetic component, involving variations in genes that regulate how uric acid is processed and removed from the body. What foods cause gout? Certain foods can raise uric acid levels because they are rich in purines, a compound that breaks down into uric acid during digestion. Consuming large amounts of these foods, or having a body that struggles to eliminate uric acid efficiently, can increase the risk of gout flares. Common high purine foods include meats such as turkey, veal, venison, and bacon, organ meats like liver and kidneys, seafood including trout, cod, sardines, and scallops, alcohol, especially beer, including non-alcoholic beer, sugary beverages and foods containing high fructose corn syrup. Reducing or avoiding these foods can help lower uric acid levels and prevent painful gout attacks. Instead, focus on a balanced diet rich in vegetables, whole grains, low-fat dairy, and plenty of water to help the body flush out excess uric acid. What else causes gout flare UPS? Beyond diet and genetics, several physical and environmental factors can increase uric acid levels and trigger gout flare-ups. These episodes can arise when the body experiences sudden changes that affect fluid balance, circulation, or stress response. Common triggers that may lead to elevated uric acid or crystal formation include stress. Emotional or physical stress can alter hormone levels and metabolic function, leading to increased uric acid production. Fatigue. Lack of rest can weaken the body's ability to regulate inflammation and detoxify efficiently. Dehydration. When the body is dehydrated, uric acid becomes more concentrated in the bloodstream, encouraging crystal formation. Surgery. Major surgical procedures can temporarily change how the body processes waste products. Joint injury. Trauma to a joint can release uric acid crystals already stored in tissues, triggering inflammation. Extreme temperatures. Exposure to very hot or cold environments may affect blood circulation and promote crystal deposits in cooler joints. Certain medications can also raise the risk of gout flares, including low-dose aspirin, diuretics, water pills, and niacin. These can interfere with the kidney's ability to remove uric acid from the bloodstream efficiently. Risk factors for gout. Some individuals are naturally more prone to developing gout due to health conditions, lifestyle factors, or inherited traits. Key risk factors include obesity or overweight. increases uric acid production and reduces excretion. Diabetes alters metabolism and kidney function, leading to uric acid buildup. Kidney disease reduces the body's ability to filter and eliminate uric acid. High blood pressure and high cholesterol, commonly linked with metabolic disturbances that raise uric acid levels. Family history of gout. Genetic factors influence uric acid regulation. Psoriasis and psoriatic arthritis. These autoimmune conditions can raise uric acid levels due to increased cell turnover. Metabolic syndrome, a cluster of conditions including obesity, insulin resistance, and high blood pressure that collectively increase gout risk. Gout most commonly develops in middle age and is diagnosed 2 to 6 times more often in men than in women, according to clinical research. However, postmenopausal women also become increasingly susceptible due to changes in hormone levels that affect uric acid metabolism. How gout is treated. Effective gout management involves a combination of medication, lifestyle adjustments, and in some cases, surgical intervention. Prompt treatment is essential to relieve pain, prevent long-term joint damage, and reduce the risk of chronic gouty arthritis. When a gout attack strikes, fast-acting relief is the priority. Common medications used to ease inflammation and pain include nonsteroidal anti-inflammatory drugs, NSAIDs, over-the-counter options like ibuprofen, Motrin, Advil, and naproxen, Aleve, or prescription forms such as indomethacin, Indocin, can help manage acute pain. Colchicine, Calcre, is a prescription anti-inflammatory that can be effective if taken soon after symptoms begin. Corticosteroids. These prescription medications provide rapid relief by reducing inflammation and swelling. For individuals who experience frequent gout attacks more than once per year, or have visible uric acid deposits known as tophi, long-term medications may be prescribed to lower uric acid levels and prevent future flares. These include allopurinol, Xyloprim, and febuxostat. Uric reduce uric acid production by blocking the enzyme xanthine oxidase. Probenecid, Probolin, helps the kidneys remove more uric acid through urine. Pegloticase, Crystexxa, converts uric acid into a more easily excreted form, typically used in severe or treatment-resistant cases. Newer therapies, such as interleukin-1 inhibitors, are also being studied to target inflammation pathways involved in gout, offering potential future treatment options. Because all medications can cause side effects, it's essential to consult your healthcare provider about the safest and most effective treatment plan for your individual health profile. In advanced cases, surgery may be considered to repair or replace joints damaged by chronic gouty arthritis. Gout home remedies. In addition to medical treatment, several at-home strategies can help relieve gout pain and support recovery. Apply ice to reduce swelling and numb pain. Elevate the affected joint to minimize inflammation. Stay well hydrated to help the body flush out excess uric acid. Try warm baths if they help relax muscles and joints. Use topical NSAIDs to relieve pain directly on the affected area. Some early research suggests potential benefits from certain natural supplements, such as guava leaf extract, which may lower uric acid levels, and cherry extract, which may help reduce inflammation. However, these findings are preliminary, and more evidence is needed before they can be recommended as proven treatments. Combining professional medical care with these lifestyle and self-care approaches can significantly reduce the frequency and severity of gout attacks, helping you maintain joint health and live more comfortably. How to prevent gout. Preventing gout involves more than just managing flare-ups. It's about maintaining healthy uric acid levels and reducing the triggers that cause crystal formation in the first place. In addition to any medications prescribed by your healthcare provider, consistent lifestyle adjustments can play a key role in preventing gout recurrence and long-term joint damage. Here are effective, evidence-based strategies for gout prevention. Avoid alcohol and sugary drinks. All forms of alcohol, including beer and non-alcoholic beer, as well as beverages sweetened with high-fructose corn syrup, can increase uric acid levels and trigger gout flares. Limit high-purine foods. Reduce intake of red meat, organ meats, and certain seafood like sardines and shellfish, which are rich in purines. Maintain a healthy weight. Being overweight increases uric acid production and decreases its excretion. Achieving or maintaining a healthy weight through a balanced diet and regular physical activity can significantly reduce your risk. Adopt the DASH eating plan. The dietary approaches to stop hypertension. DASH diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, foods that support healthy blood pressure and lower uric acid levels. Stay hydrated. Drink plenty of water throughout the day to help the kidneys flush excess uric acid from the body. Add lemon water. Drinking water with lemon may help make urine slightly more alkaline, which can aid in neutralizing uric acid. Consider moderate coffee consumption. Some studies suggest that coffee may lower uric acid levels, possibly offering a mild protective effect against gout. While these lifestyle measures can't replace prescribed treatments, they greatly complement medical therapy by reducing the likelihood of future attacks and improving overall metabolic health. By combining consistent medical care, healthy nutrition, and smart daily habits, you can effectively manage gout, prevent painful flare-ups, and protect your joints for years to come. Gout is a painful form of arthritis that develops when uric acid levels in the blood become too high, leading to the formation of sharp uric acid crystals in the joints. These crystals cause inflammation, swelling, and intense pain, most commonly in the big toe but also in other joints such as the ankles, knees, and fingers. Several factors can contribute to elevated uric acid levels, including genetics, certain health conditions, and a diet rich in purines. Foods such as red meat, organ meats, certain fish and shellfish, alcohol, and items containing high fructose corn syrup are known to raise uric acid levels and trigger gout attacks. Treatment for gout often includes anti-inflammatory medications, uric acid, lowering drugs, and simple home remedies like applying ice, elevating the affected joint, and staying hydrated. Preventing gout involves avoiding high purine foods, maintaining a healthy weight, and adopting balanced eating habits such as the DASH diet. With proper management, lifestyle changes, and ongoing medical guidance, gout can be effectively controlled, helping you stay active, comfortable, and pain-free. If you found this video helpful, don't forget to like, share, and subscribe to HeInfo, your trusted source for science-backed health information. Turn on notifications so you never miss a new video on managing chronic conditions and living a healthier life.